CSWAs and certain agencies are basically directing their CSWAs to, instead of actually documenting the number of direct hours that they've received, just do a 70% calculation of your total work hours. 70% of that is just put it down as direct contact, and it's really not the intent.
Some agencies are doing that, or some
Yes.
supervisors are doing that.
Supervisors are directing CSWAs to do that, and then the CSWAs are submitting 6-month reports with hours that directly compute 70% of the hours that they've been working, and they count those as direct.
That sounds like an.
Oh, okay, all right. Okay.
Yeah, I don't.
Now,
think
this
so.
is where that's gonna lead.
Well, that's why I think that sounds like you need to go back and re-educate supervisors on what's appropriate or not.
Okay, cool. I just wanted to check in with the board to make sure before we enforce that,
Yeah,
that the board is not in agreement on that.
I would definitely,
Okay.
have the supervisor.
Oh.
And then the last thing that Ray wanted to talk about was in the definition of agency, it states employee, and so you want to talk about independent contractor versus employee.
Yes, so once again, just seeking guidance, or if you all want to initiate a rule change, I'm encountering more of these agencies that fit our current agency definition that are asking CSWAs to sign on as independent contracting, independent contractors instead of employees. When we follow up on these plans of supervision that come in, these employers give us nice flowery terms like they're a contracted employee, or they're an employee with a contract, or they're all of these things that don't say specifically employee. Rule says employee. So does this committee have any concerns about, as an organization or a staff, when they find someone who might be an independent contractor as their sole employment, we ask them to find a place where they become an employee or to deny that application. Because CSWAs, and I've talked to practicing LCSWs, I've talked to supervisors about this issue, I've talked to academia about this issue, and they all agree the same thing. Independent contractors is outside the scope of what a CSWA is as a primary, job.
Good job, right?
So,
Good
but
close reading.
basically I'm asking for guidance. If there's any concern with us, when we get a CSWA that signs up as an independent contractor as their primary job, we ask them to either find a job where they're an employee, or we let them know that based on what they're submitting to us, they're not an employee, and we would have to go through the steps of denying the application.
Okay.
And the rule says they have to be an employee, correct?
Yes, I can
It said
pull up the,
agency for the
Yeah,
purposes
right here.
of.
it's under agency definition. First, it's the first thing right under agency
Yeah.
definition.
It says employee, so
It's right
if
there.
they can't provide a W-2, then they're not an employee.
Right, they won't provide 1099s.
Yeah, 1099 is independent. If they can't give you a W-2, then
Yeah.
It-
Well,
good.
but we don't have to go through that. So I talked to Kyle about this. We don't, the bar is, are you an employee or are you not? And then if they say anything other than employee, it's denied. We don't have to do any more than that. We don't have to ask for a W-2. We don't have to ask for 1099. That's not our responsibility.
then
And then we let them know that their ethical responsibility as a CSW and what they signed up for. So they're attesting that they're an actual employee. And if we find out later that they're not, then they're subject to actions from the board.
I was, right now, I'd say deny and stay with our definition unless you want to change the definition, and then.
So what's gonna happen? Because is this gonna make a rash of CSWAs who?
Yeah, so we have one organization that you are familiar with, Mindful Therapy, which I plan to reach out. And of course, I'm gonna be thoughtful in how I pursue. I'm not gonna leave CSWAs hanging out with no chance. I'm gonna say, hey, and we don't have to go through Mindful Therapy because I don't have authority over agencies. We have authority over CSWAs. So we reach out to each CSWA and say, we're asking that you attest that you are an employee. And if you are an employee, then you are attesting that. If we find out later that you're not, then you might be subject to action from the board. You have 60 days or whatever to become an employee in an organization. And then explain that to them and give them 60 days to comply. And then if they don't, then we'll be.
Give them a
using
little
those
bit longer than
practices.
60 days, because I think with mental health jobs,
Okay.
it's like, sometimes it takes a really long time to get
What do you think is?
I mean, 90 days is like,
90 days.
is reasonable. I don't know, but even that.
Well, that's fair. I mean, we're not trying to go out and beat people up, and, you know, if that's a reasonable time, that's a reasonable time. Do you have thoughts on that, Stephanie?
No, I agree with that. I think
Yeah.
that's fair. I mean, you've got it, and they should, when they first sign up as a when they first get their certification that way, they should have that information first off,
Yes.
and then follow up on their first whatever report, and then see if that's happened.
And keep in mind, we don't really have a mechanism to police that.
Yeah,
If we look at an application and it indicates from based on what we're seeing that that person is an independent contractor, then we'd act. But if we don't see anything there, then we don't do anything. They could be an independent contractor. That's not, I'm not having the staff point out to every single person find out if it's
Right.
an independent contractor.
and then does this still leave open? So for instance, if somebody opens their own,
Yes, now they can. So as long as you have a job as an employee, then you can do whatever you want on the side. But those hours, you got to still do it under supervision because you're still a CSWA, and those hours are not accrued towards the CSW.
so before though too, like there was some kind of loophole where people could open
Yes,
their own practice.
can.
They hired a
Yes,
supervisor, or
absolutely.
like a billing
Yes.
company.
yes. So if you're a CSWA and you open up a business and you have an administrative supervisor, we talked about that, but that's a term, but and we'll talk about more of that.
Yeah, yeah.
An administrative supervisor and a plan supervisor, and you are an employee within your organization, then you qualify. That's it.
Okay. So I wonder if mindful therapy is gonna try to do that.
They can, and if they do, that's fine.
You're like, well, actually, we're just like.
They comply.
But,
They're just the billing piece.
Yeah.
Right now, they're just a service provider. That's all they are. They're not an agency, they're a service provider.
Right,
That seems equitable, and that seems fair.
yeah, yeah, that at least makes it clear too,
Yes,
that like, that's
yes.
what they are, they're like a.
Middleman.
Yep, that's all they are,
Well,
is the
and
middle.
we know that.
Service
Because-
middleman.
All of those CSWAs have their own businesses.
Yes.
But we
Yeah.
don't know
Exactly.
how they operate under their business. We don't know that they have
Right,
another supervisor, somebody who's actually working for their business.
there you go. We have no evidence to believe that they're doing, that their business qualifies under the agency definition.
Because they
Now-
provide mindful therapy as their
Right.
agency as well.
Yeah.
Now, what they could do is switch over to their own agency and use mindful therapy as a service, and they can do that. And then they just have to get their own administrative supervisor and open up, and they can, and that's completely,
In the
How would
definition.
somebody learn how to do that? though?
there you go. It's a very small population. of people. And that was the data point that let us know that there was something going on. There's a very small population of people that actually know how to do that. Yep.
I wouldn't have thought of that. until-
There you go.
Well, they've only opened their businesses because mindful therapy told them to. They were required to.
Exactly.
And get their own business insurance and everything.
Right? All of their,
Yep.
most
So-
of them, and I started a spreadsheet before I started doing investigations, I started a spreadsheet and it shows their business was created December 15th and the
Yeah.
plan started December 15th. I mean, it was clear that it was,
I like
You know.
this, I mean,
And there's no prohibition on CSWA's having a business, it's just you have to do it in a certain way.
it's not gonna shut down mindful therapy ultimately either, it's just gonna make
Yeah,
it.
well,
so
that's
that
not the goal,
The
right?
paper is gonna, like, the paper trail will be clear
Yeah.
about
I wonder
who
if
the
they're doing
agency
different,
is.
different concessions to different states.
Well, so I actually talked to two clinicians about this, and basically, they go state shopping. So what they've done is they settled on Oregon because our rules allow them to do what they do. We have a big fat hole in our agency definition. They came and took advantage of it. You'll see that they don't operate in every state. In states that don't allow them to do what they're doing, they just don't go into those states.
Right.
So they're taking advantage of our rules, basically. is what they're
Yeah.
doing.
Yep.
so the rule is rewritten.
They're probably.
Yeah.
run
And
by
we'll fix the
AI.
rule, I guess, right? We're gonna fix that.
It's on the list of the three
Yeah.
things that they,
Yeah,
we're gonna look
and
at.
take care of that.
Yeah.
And those three things are, Patty?
It's definition, client, definition and direct contact.
Correct.
Yes.
Nice.
You passed.
Are you gonna bring this up though, Stephanie? This part about the, or, cause we're,
You're in charge of the rules committee. I'll be the chair, so you get to report on what the rules committee will be looking at.
okay.
You can solicit, support or information from any of the people on the board. Say, if you have some, these are the three definitions. If you have some strong feelings, please contact me so that my committee can review that and.
I don't know if anyone's interested on being on that committee.
Yes, absolutely. This will
You have to be close. You have to be
Wait, I'm forgetting something. Did I get assigned to the rules?
You did. This next, And this next time around,
You're on every committee.
Apparently.
well, the only one you haven't been on is CPC, correct?
Yeah, I've been on that one.
So I think this next year, that should be, when they reassign the committees, you should go to CPC, because you really need experience over there.
When did I get assigned to the rules committee? When did that?
You're not assigned. It's you two just
It was-
go.
Because we were the only ones
Okay.
available, we got
Okay,
it.
I think actually there is technically someone assigned to it, but I might actually, you might actually be one of them members.
I was
Wait.
originally, and I don't.
Yeah, I think
came-
it might typically be with Amy.
Oh, yeah, Amy too, but.
Oh, no, it's actually, wait, this is a old one, never mind.
I don't
It
like
used to
being
be
on it.
Kathy
I
and
just didn't know I
Amy.
was.
It's been about 5
They,
years.
they
now.
haven't, cause they're just,
I was gonna say.
It was me, Kathy, and,
Amy.
Okay.
no,
Just a couple minutes to go to the bathroom and,
oh yeah, we need to get going in the
get
other
to the
room.
next meeting.
okay,
Okay.
So you've got 3 committee reports, Patty.
okay. Anybody want this thing, or do you think somebody could shred it for me, or? I
What
think
is
this was
it?
from Stephanie's stack
Oh, I'll
originally.
keep it.
Oh, I've got, so I'll throw all this away at the end.
I got 7 more years,
7 or several?
so
You don't have a number?
I got a number, I'd say.
Yeah. How do I make it toward
That's a good number.
Yeah.
So that is us.
What number?
Okay.
My son and his
What's
wife
it,
were the Alaskan
Hey, Ray, can you hear me at all? I can't hear you
Can you hear
guys.
us?
Yeah,
There we
you were
go.
muted.
Now I can.
Okay.
There we go.
We're gonna start off with board member acknowledgement. We have some new board members. Hooray, hooray. This is the biggest crowd we've had in several months. Usually it's just 4 of us. So I would like if you each take a moment and introduce yourself and tell us a little bit about yourself. I'm going to start with the online people here, and Julie, you are one of our new members, correct?
That's right. Hi, everybody. Julie Majors. I live in Beaverton and not sure what else you want me to tell you. I think I really show up for all of the work in mental and behavioral health through the lens of family lived experience, and really honored to be here, part of this group.
Where are you from, if you don't mind us asking?
Um,
You said that already. Okay.
Originally, where do I live or where am I originally from?
You already said it.
Are you retired? Or are you actively working or
No,
just?
I'm actively working at OHSU, and we have a contract with OHA supporting the Children and Family Crisis Response System, so various services and programs. My team does data collection.
So
we
maybe
do
for
technical
some of our,
support.
for some of our public members in particular, Julie, can you let folks know, as a board member, are you a community board member? Are you a licensed social worker? Could you provide that context so folks have that?
Yeah, my formal, I suppose, licensure would be around family peer support services. And that's in the peer delivered services under the traditional health workers. But I'm doing more upstream support and technical assistance to the workforce serving children and families.
You're a public member.
He's a public.
Thank you.
Public member, yes.
Yes. I want to highly
Not
encourage-
representing OHSU, representing individual public lived experience role.
And the public members are very, very important, and I will encourage you to speak up and be empowered to ask questions, and don't be intimidated by all of our licensed people here that.
We're pretty intimidated.
Yes, yes, you are. Anybody taller than me is
Thank you.
intimidated.
Sure appreciate
So-
that.
And
Thanks, Julie.
our next new member down there, Olivia, I'll let you go in.
Okay, hi, I'm Olivia Borman. I'm a CSWA. Originally from LA, went to school in the Bay, and then moved up here in 2019. Went to PSU, graduated 2023 with my degree, and now I've been working towards licensure at a group practice that serves primarily BIPOC folks. I also work, and I do that part-time, and then I also work at a small nonprofit in Oregon doing work for Pacific Islanders and specifically Samoan folks. So I do finance and operations there. So I just get to look at numbers, and then I deal with people. So yeah, happy to be with you.
Yay.
And
Welcome.
Nicole.
Hi, my name's Nicole Pantley, and I'm here as a public board member, but my background is in substance use disorder. I actually am the regional director for an OTP. So we have 6 OTPs across Oregon, specializing in rural
What's
areas.
OTP mean?
Opiate Treatment Center.
Okay.
So I mean, opiate treatment program, sorry. So specializing in methadone mainly. So that's what I do, and that's why I'm here. And I'm here because social workers are what got me here. Without social workers, because there wasn't a lot of drug and alcohol counselors back in the day when I needed one. It was social workers who made a difference in my life. So y'all are important to me.
Thank you and welcome. Welcome to all 3 of you. And hang on, what do they say? What do they say? Buckle up, Buttercup. We're off and running. A review and approval of the agenda.
Whoa.
It's not important.
Yes, it is. So there we go. All right. So we come to a moment that I am very excited about. Unfortunately, this is Stephanie's last meeting. She has been our board chair ever since I started here, and for a long time. And show everybody what you got.
I didn't want a plaque because I got no place to put a plaque. Yeah, but I put a piece of paper in my scrapbook and call it good. That way.
So I wanted to say a few words about what it's like to work with Stephanie
Ooh.
and how much I have really appreciated. So for those of you who don't know, I have been I'm fairly new here. I've been in this seat for about a year and a half now. Stephanie was at my interview and thought that I might make a good fit here. So I really appreciate working with you, Stephanie. I mean, I honestly do, and I'm not just saying it. The thing I appreciate most about working with you, Stephanie, is that you are honest and you are direct. Very concise, straight to the point. There's been times when I've had to call you about various things. And Stephanie's like, what you got going? Like, no nonsense, no beating around the bush. I don't have to flowery language with Stephanie. I just, here's the thing. I recall when I first started working here, there was something that happened. And Stephanie came and she grabbed a seat in my office and she said, Ray, sit down. Got to talk about this thing. Yeah. And she was very honest and direct with me, gave me some direct feedback. And we worked with that. And I really appreciate you for that. You have always been honest with me. You don't beat around the bush. You don't play. If I want honesty and I want an honest opinion, I know to call Stephanie. Stephanie's going to deliver it to me. She's going to be tactful about what she says, but she's not going to mess around. She's not going to mince her words. You are very engaged and very interested in the work of the board. And that's the reason why anytime I've ever had to pick up a phone and call Stephanie and consult with you on anything, I appreciate those conversations because I know you're very engaged in the work that we're doing, and that you are very interested in supporting social workers as a board member. You always make yourself available to me whenever I need to contact you. There's never been a time when I've had to reach out to you and you didn't find time on the calendar for us to consult. And I hope I didn't bother you a lot, but in those times when I need you, you've always been there. I have learned to really appreciate your leadership. You actually own the role of leader. You own the role of being board chair. I think you're a great role model in that role. I think you're a great example for a person to follow in the role of board chair. And I really appreciate your contribution. I'm glad that I walked into the board with you as the chair so that I have an example of what a good board chair is. You have always cared about your legacy. So in our conversations, sometimes there's decisions that need to be made right there on the spot. Sometimes there are decisions that have long-lasting effects over the lifetime of social workers. And you've always been mindful of those decisions and how they affect the long term of all social workers in the state of Oregon and the Oregonians that they deliver services. So I've learned to really appreciate that about you. And you are very passionate about the work. And that's something I need in this role, is to have someone who is an advocate for everyone, not just any specific skill set, but for all Oregonians, and then to be passionate in the actions around that. And you demonstrated to me, that and we still, in our roles, we have to be very careful about making sure that we're advocating for every Oregonian or for every customer that we have. And you've demonstrated leadership in that. So I just want to say I really appreciated you as board chair.
Thanks. Pass the Kleenex, please.
Right there.
So if you don't mind, I'd like us to give a round of applause for Stephanie. But thank you so much, Stephanie. I appreciate you.
Can we move on?
I was like, that's what we get to say, or
Yeah, y'all can.
finally.
Yes, no, you have. Oh, that's up to Stephanie. It's up to Stephanie.
Yes. All right, Ray, do we have a public member that?
Yes.
Yeah, have her come in. Sorry about that.
So the question is if you would rather have people say things to you privately versus in the public meeting.
How embarrassed do you want to be, basically?
Go for it, because I'm not going to be back there. He said I was on, my family would describe me as blunt and tactless, but
Oh my gosh. That is not how I would describe it.
Hey, but you know what you get when you walk in the room.
they do know.
It's very sweet.
This is being recorded, so you'll be in time.
I do want to say, Stephanie, as I've gotten to know you, because I think you were here before I came on, and that what Ray said, I agree with a lot of what Ray said. But I think what I most appreciate is you are interested and curious. You always come seeking to kind of understand. And I think that's a really valuable, I'm not even going to say skill set, but just presence to have and lens to have in this kind of environment. I think when we come to the table, literally, that if we come thinking we know the answers already and not being curious about like, what is it I don't know? Who am I not hearing from? What do I need to understand? That's where boards get stuck and ineffective. And I think that, you've always come with a curiosity and interest in other perspectives. And I really appreciate that.
Thanks, Mom.
One, I love spending time with you. But the other that because I'm a clinical social worker, like I often see through that lens, and you can keep it very real for me about the public perspective of the work that we do, the big decisions we make, and the impact that social workers can have. And you have always brought that to my attention and put me in check around that, which I love. And I think I will also probably say similar to Molly that you ask lots of questions and you
Yes.
want to know.
Yes.
And that to me says like, I really am interested in the really important work that gets done here that could have an impact on my profession, but could have a bigger impact on the people that we serve. And so one, thank you for doing that for us. And thank you for mentoring me and kind of walking me through trying to be a co-chair with no guidance. So just a lot of appreciation of your willingness to help me in performing duties that I needed to perform.
Thanks.
And I gotta say that like when I got on the board, like and I didn't know really what I was doing, you were a great mentor, Stephanie. and
Thanks.
Showing us what to do and also getting on me about going and do the ASWB training, which I still haven't done.
But then are there opportunities coming up this fall? Thanks. I can move on.
The board chair.
It's really been great though to be on the board for these 8 years. I've met a lot of people, a lot of different people, and I am curious about what you do. And I know I ask a lot of questions, but that's just because it's important. I'm not here just because it's been a really important part, and I've learned more than I ever thought I would. I thought I would just be taking a seat and taking up time, but it's been an experience and an education, and I advocate for your profession all the time with the public. So thanks for having me.
We appreciate you.
Thanks. Okie dokie. Review and approval of the agenda. Do I hear a motion? Do we have any additions or changes?
Motion to approve.
Here a second. New board members, you can also second our motions.
Amy just second.
Okay,
Oh, sorry, this is the email.
all in favor, say aye.
Aye.
All opposed? Any abstentions? Motion carries. The agenda is set. Approval of the minutes from April 25th, 2025. Did everybody get a chance to take a look at the minutes? Do I hear a motion? Patty? Do I hear a second? Nicole?
This is Amy and I'll second.
All right. All in favor?
Aye.
Aye.
Julie, in favor?
Sorry, I wasn't a part of the meeting, so I put in abstention.
Oh, okay. And I didn't see that on there. So,
Okay,
motion passes.
Did you, okay, I know you asked those in favor. I think you do have to ask any
Any
opposed.
opposed? Yeah, and then abstentions. Yeah, it's only been a couple of years.
All right, there's a lot of people in this meeting, so.
Yeah, there is. So, motion, any opposed? Abstentions? And that was Julie.
Yep.
Motion passes. Public comment. It is your turn, Peanut Gallery.
Well, good morning. Hi, Angela. I recognize you from the Oregon Health Authority. I'm Jennifer Wells. So I come today with an agenda. I believe I had sent kind of a little bit of the talking points. But good morning and thank you for the opportunity to speak today. My name's Jennifer Wells and I'm a licensed clinical social worker, a supervisor and advocate for the profession. I am here to respectfully urge the board to formally recognize that client-specific care management tasks should count towards the direct clinical practice hours for CSAs working towards their LCSW, even when the tasks are not face-to-face. It matters because what we do as social workers is more than sit in a therapy room. Our work includes assessing our clients' needs, creating and updating treatment plans, collaborating with our IDT, so our other team members, writing psychosocial summaries, and advocating for critical services. Most of those tasks would not be something you're sitting next to a client in a hospital bed to do. It requires you to be at an office, waiting on the phone. They're not extras. These are foundational to clinical practice, and they require the same clinical reasoning, ethical decision-making, and advanced therapy does. Our rules, Oregon Administrative Rule 877020, indicates that assessment, diagnosis, treatment plan, and prevention of psychosocial dysfunction is part of our social work duties. So the NSA, so talking about ethics, the ethics call on us to promote client well-being, ensure continuity of care, collaborate with other professionals. Client-specific care coordination is an ethical duty. It's not just paperwork. It's often what keeps someone from falling through the cracks. And my understanding as of today is that these CSWAs are being told that that work doesn't count because it's not direct face-to-face contact with clients. It's demoralizing and it seems very inequitable to spend that much time advocating on behalf of someone using our clinical knowledge and experience and not have those hours counted towards our actual work that we're doing. Because 2,000 hours is a long time, especially when you're only getting 15 or 20-minute chunks of client time and you're spending several hours, up to 70% of your time in service of the client. And we're asking for parity. So other boards or LPCs, LMFTs, and psychologists routinely count documented client-specific care management towards licensure, as long as it's tied to treatment and clinically supervised. Social workers should be held to the same reasonable standard, especially as we increasingly work in team-based, interdisciplinary settings like hospitals, schools, and crisis response teams. The consequences of not considering this is that CSWs are being penalized for doing their actual job. In many hospitals and crisis roles, we spend 60 to 70% of our time on clinical care coordination. If those hours don't count, that means you're either working unpaid overtime somewhere else, trying to get those hours and accumulate them, or a lot of us have second jobs, which makes us very tired. It's not a sustainable system, and it creates a two-tiered licensure track where only those with financial security can afford to stay on the path. And delayed licensure means income. So we'd just like to promote the equity, retention, and licensure access for all social workers, not just those in traditional therapy roles. And that's all I have to say about that. And I do appreciate having the opportunity to speak on this. I know my track to licensure, I was at the Oregon State Hospital. And so, yeah, I understand that a lot of the coordination does come with having direct access to other professionals and providing that not direct service face-to-face, but direct service. So as I'm taking on being a supervisor, I want to just continue to advocate for our profession, knowing that most of the work we do behind the scenes is just as important as the direct face-to-face hours. Thank you. Great time.
Thanks, Tim.
The board
Seems like maybe it
recognizes,
would be an okay time for me to go, sorry. My name's Angela. Is it okay if I speak? Can you hear me?
Yes.
Okay, I'm just here for public comment, and my request is similar to Jennifer, so I figured it would maybe be a good time to just kind of piggyback off of that. I've been a licensed clinical social worker since 2017 and a certified case manager since 2022, and a board approved CSWA supervisor since 2019. I'm here representing roughly 40 social workers who are employed here at Salem Health in various roles such as mental health evaluators, palliative care social workers, emergency department, women, children services, oncology, acute care, post-acute care, on and on. And I just wanted to pose to you my question is who you feel is the client, quote unquote, in these following scenarios. A patient with dementia whose families talked him into signing over his home and now has been abandoned at the hospital. A Latina pregnant mother with 4 children who contracts COVID-19 and is on a ventilator and family is devastated, and she's not going to survive. And the MSW is asked to break the news to her children. A severely mentally ill patient comes in with advanced cancer because he is lost in the cracks. The treatment team says he doesn't have capacity and he will die without surgery and other treatments. And the MSW is tasked with tracking down family. An Indigenous patient is admitted to ICU during COVID-19 and they are not going to survive. And the hospital has a strict one visitor policy. And the social worker is the one who advocates to allow the entire family at bedside, since their tribal customs include the entire clan holding vigil over the dying person to ease the pain until the spirit leaves the body. A person experiencing mental illness is evicted from their care home after his private pay money runs out. And the social worker helps advocate for licensing and ombudsman office to attempt to let him return to the only home that he's known in 20 years. A NICU baby is born at 24 weeks to 2 young parents who work low-wage jobs and are now facing a very long hospitalization. They need help figuring out how to pay their bills and care for their other children. A family of a patient lunch and rushes up when they hear a code blue. That's an emergency code happening at the hospital, happening in their mother's room. And you were still with the family so you attend the code and you're with the family during the code, and you're consoling them after she dies. And you help them find resources for burial since they confide that they cannot afford the after-death arrangements. An older patient who's fully alert and capable of making decisions insists on returning home again, even though they can't walk or care for themselves. And a new doctor comes onto service and places a medical hold, even though the patient is stable for discharge because he does not like the choices that the patient is making. You advocate and coordinate with the medical ethicist, and you educate the provider about client self-determination. So according to recent changes or recent maybe enforcement of the changes to the CSWA supervision reporting requirements regarding the direct client hours, none of the time spent by the social worker in the above scenarios would actually count for reporting purposes for direct client hours. So while I agree that direct face-to-face assessment and intervention is an important clinical ability that should be accurately recorded and reported when working towards licensure, but I do not understand it. What I don't understand is how we as hospital social workers are to determine who our quote unquote client is. Hospital social workers, we don't enter into a contract for services. We're not engaging in ongoing therapy relationships, even though many of the interventions we provide are considered therapeutic. We have a much broader view of who we consider our client, quote unquote, to be, as provided in the examples earlier. Social workers as a profession, we are much more than just therapists. So I think it's unfair to apply a one-size-fits-all approach when it comes to reporting direct client hours. According to the Oregon Secretary of State Administrative Rules, Chapter 877, direct client contact for purposes of meeting the requirements of the plan supervision mean clinical social work practice hours by licensee or in person or via conferencing or telehealth conferencing with a client. It does not specify who the client is. And in fact, later in the rule, it does say the practice of social work means the application of social work theory, knowledge, methods, and ethics to restore or enhance social, psychosocial, biopsychosocial functioning of an individual, couples, families, children's, groups, organizations, or communities, and may include private practice administration and the provision of clinical supervised teaching. The NASW practice standards for clinical social workers says clinical social work focuses primarily on the mental, emotional, behavioral well-being of individuals, couples, families, groups, organizations, and communities. So as social workers, we are taught not only to consider our quote unquote client, the person sitting in front of us, the person that's in the hospital bed, as our patients or our clients, but our client's relationship with the environment. So our client's environment is their family, their friends, their surrogate decision makers, their long-term care facilities, their county service providers, etc. Our request is that medical social workers, that our time spent with not only our patients be counted as direct client hours, but that our time spent with their families, their service or care providers be counted. As we advocate for shelter or placement for the unsheltered, as we sit with grieving families or their loved ones, as we sit with grieving families and their loved ones as they are being taken away for organ donation, as we explain the disease process of dementia or cancer to a spouse, as we educate our medical providers about the unique cultural considerations of death and dying or child rearing. Thank you for your time and your consideration of this request.
Thank you.
Thank you.
We have Miranda Bass. You have something?
And then we
I just
also
want to give
have,
other folks.
we have one other person that wanted to make, oh, okay.
This is Mandy. She's my new supervisor who is going to be working at Salem Health
Did
actually.
Mandy want to make a statement?
I can make a quick one. And I come prepared. Like she said, my name's Mandy Storm. Hi, Angela. I am a recent graduate from Portland State University with my master's of social work. And this is my individual supervisor. In my time at school, I had 2 placements. One of them, my generalist placement, being at Salem Health, which is also an amazing experience. And my second one was with Willamette Family Medical Center. And while these placements were very different in that one is at a hospital and one is at a primary care with an integrated health team there, they're also very alike. As I sit here and I was listening to Angela speak about all the examples of, patients and what we as social workers experience, I sat there and I listened. I was like, wow, during my experience there, I dealt with over half of those things and then some. And then I'm also listening and I'm like, all of the things that she's saying that we're doing for these patients, I also did at my other placement. So we're doing it both, whether it's direct therapeutic care, where you're doing maybe short-term or long-term therapy, or whether it's care management. And I sat there thinking, wow, we really deserve to have all of these hours counted, because whether we're face-to-face with the patient, we are still doing clinical social work. We are providing motivational interviewing. We are safety planning, doing suicide risk assessment. We are working with families. We are working with other outside organizations such as short-term and long-term care facilities, and really trying to plan for these patients so that they can have successful discharges. We experience secondhand trauma from their trauma. And I believe that we deserve to have those hours recognized because of that, because we are putting in the work, we are doing the work. So we deserve to be recognized for that work. Thank you.
Thank you, Mandy.
Miranda?
Hi, thank you. My name's Miranda Bass. I'm a social worker at the Portland VA. There are over 300 social workers here at the Portland VA, and I just want to piggyback on all the comments that have already been made and advocate for a more broad, I guess I would say, example of what direct client means. I'd like to just give a quick example of my own experience when I was being licensed in 2016. I had to counsel an an ICU fellow who had had a conversation with a 36-year-old veteran about his code status. That veteran subsequently had a heart attack in the ICU, was coded and intubated. Days later, his family had to remove that intubation, and that fellow, that doctor, had had a conversation for that veteran to change their code status from DNR to full code because of their age. And the guilt that that provider felt and the desire to change their entire work life from that one experience was significant. And I spent a lot of time with that provider. And I think as social workers, that is direct client work as it relates to the patient. However, in the what feels rather narrow scope that the hours are being counted at this point, you as the board now would not allow for those hours to be counted that I spent with that provider. So I just wanted to give another sort of very specific example of the clinical work we do as hospital social workers that in the current definition as it's being applied would not be allowed. And at the VA, we have medical social workers doing housing, social workers doing mental health, social workers doing outreach to our transitioning veterans. And to just piggyback on what Angela said and what I've heard other people say, I think we're doing a disservice to the people of Oregon that you speak of and that you are here to protect by calling the work that we do not clinical, when it's all very clinical, when we're doing this advocacy for our patients, their families, and even the providers we work with. And I appreciate you giving me a moment to talk today.
Thank you.
Thank you, Miranda.
Is that all the public comments?
Including online? Double check anyone else online?
I don't see anybody there.
Oh, there's a question. Yeah.
Well, she means she doesn't see anyone indicating.
No,
I guess let's make sure and be clear, this is the only opportunity for public comment in today's meeting.
No, we have-
Or is there another one later?
Okay.
Just want to make sure.
Yeah, and put 2 in for that reason.
Half hours.
Going to move forward then to executive session. And at this point, the public is going to have to leave while we go through our executive session. How long, Mindy, do you think that's going to be?
I'm gonna say 10 minutes, 15 minutes, but it just depends on if there's discussion.
Okay. So if you want to check back in, or do you want to email everybody, or just have everybody check back in 15 minutes? Okay, so give us 15 minutes.